try to decide whether to pull down the screen or there's enough chalk on there. I think it's white enough this time. Let me turn on the projector here. Anybody know in this room? Experts, so you know how to turn it on in here? The projector?
That
Oh,
remote.
it's right there. There it is.
I think it's a bad bowl.
It's pretty dim.
Is it pretty dim?
Yeah, but you
Well,
can
we
still see
can
it.
go with it.
More than it was. It was really dim in
It's
Okazaki.
sort of coming. Let's see. We're going to just do the output. Change the input. There we go. Okay, what I wanted to do, I'm going to show you a picture, and you guys get to tell me what it has to do with a medical school interview. By the way, hi, James. So, here we go. I said not do the Pepsi Max one, but what does that have to do with medical school interview?
Feels like you're being ignored.
I know, it's really hard to see that. Let's turn on the light just a second. Yeah, I mean, sometimes we tend to have those feelings, don't we? Like this is something we're walking into, you know, that the interviewer's there to kind of chew us up, spit us out, see if we survive. In reality, you guys, understand that the interview, the day of the interview is going to be a two-way process. And the fact that you guys are showing up for this interview and being invited to go there says something about you. What does it say about you? Medical schools like what they see on paper, right? Otherwise, you wouldn't be going to see them and talk to them. And so one thing that sometimes surprises students is a lot of what you're going to see happen that day is meant to impress you. And it is a two-way street. But understand also how important it is to prepare for the interview. And we'll talk about those types of things you can do to prepare. So today, just a brief overview. I want to talk about what to expect during the interview, some common mistakes, give you some tips for preparing. And then we'll talk a little bit about the day of the interview, give you some pointers for some things you can do there. And I will talk to you about the mock interview that I can do with you and how to set that up and how to prepare for it. So, first of all, what is a medical school interview like? What do you expect when you go? Has anybody had one in here? Yeah? Okay. Anybody else? So, give us an overview. What was it like to go do it?
It was intimidating.
Okay.
Like, I know it was not quite what I expected. I expected it to be worse than it was. It sounds kind of funny, but like once you get started on the interview, it's a lot more low key than I was expecting it to be.
Yeah, and I hear different feedback on it. Different schools have different styles. I even had one person that told me I was waiting for the interview to start, and it was done. And it was so low-key that they were expecting that. But I've had some others that it's very direct and, you know, with the questions. So, positive experience overall?
I guess so.
Positive to have over.
Yeah.
Well, let's just talk about a few aspects of it. Number one, some types of situations you may run into. Most of us have interviewed someplace, right? And so we tend to think of an interview as, you know, you walk in and there's somebody at the table and we sit down and they ask us questions. And so for a medical school interview, there's different scenarios you may run into. Number one, it's most of the time, if it is kind of a direct face-to-face interview, you're likely to be interviewed by a committee. So multiple individuals. Was that the case?
No, I had separate
So
interviews.
you had separate, were you doing multiple minis?
I had one multiple mini, and then I had one
Okay.
or 3 interviews.
Good. So it's possible you could have one person interview It's very common to have multiple, who else might be there, I mean, who might be interviewing you besides admissions committee? I mean, you might have med students in there, you know, so there's other possibilities around that. Sometimes students run into group interviews. So there's individual interview, we talked about that, where you might actually also have other candidates. That's a possibility. And then multiple mini interviews are another possibility. So we're going to talk about some of those different scenarios in a minute, but let's go through and just give you an overview. What types of things are they going to be asking you and wanting to find out? What was that?
Why do you want to go to medical school?
Okay, very, very common. I mean, they're going to be interested in your motivation, you know, for applying, both to medical school as well as to their program. What else might they want to learn about you?
Why are you interested in the state or that particular region?
Okay, yeah, why come here? Where are you planning on working after? I mean, we'll sometimes be asked, but you know, why are you interested in our program and coming out here to do your education? What else? Yes?
To see if you're a good fit with their program.
Okay, that's kind of the gist of what they're looking for, isn't it? You know, strength, okay, go ahead.
I was asked a lot of ethical questions.
Okay.
What would you do if?
Yeah. What would you do if? Behavioral and ethical questions. Other things that are really common during the interview. Yeah.
They asked me to expound on things I put in my primary application.
Okay. So it's a chance for them to follow up on things that are there. What types of things do they expound on?
They asked me about my research project that I worked on. They asked me about volunteering that I had done.
So very common, your experiences, your research, also sometimes weak areas of an application or a background will be asked about, so you know, be very familiar with your own application. You know, I look at it as kind of like, you know, ice cream. You know, there's all these different flavors of ice cream out there, but in reality, you know, they're really mostly made of the same thing. And when you look at questions, really, there's a few major types of questions that you're going to be asked. And let me give you the types, and then we'll talk about some examples. Sorry, the presentation does not look that bad. I know it looks really crappy, all dim up there. But open-ended questions. These are broad, and you have a lot of flexibility in what you choose to share in responding to that question. Give me an example of some common open-ended questions. Yes?
So one could be, what type of challenges do you think a physician will face in practice medicine?
Okay, that's open-ended. There's no specific thing. Even more open-ended than that.
Tell me
Yeah.
about yourself.
Tell me about yourself. I mean, and believe it or not, when I do these mock interviews, I'll probably start with that question. The two toughest questions for people to respond to that people really mess up the worst on during mock interviews, what do you think they are? Tell me about yourself is actually one of them, believe it or not. What do you think the other one is? Weaknesses is a difficult question. But tell me about yourself. People really struggle. And it's not a tough question. It's just you're not really expecting that. You're expecting to be directed. And when it's kind of left up to you to talk about something, what are some of the mistakes that you think people make in responding to that question? Yeah.
Maybe answering things that the interviewer already knows.
Okay.
I don't know.
Okay. What else?
Maybe not discussing things that are focused on your purpose.
Yeah. The way I view it is I view this as an opportunity. And it's not so much that people are saying things that really are going to hurt them, but they're just really missing the opportunity to talk about things that would be relevant in there. So sometimes people get so much into demographics and, you know, I grew up here and this is the number of people in my family and I've been married this many years and I have this many kids. You know, I mean, it's all right to add a little flavor, you know, of something that you would like them to know, but quickly get to things that you think are relevant, you know, for the setting that you're in. Does that make sense? So we'll talk about that. If we have time, we'll practice a little bit and have some fun with it. What are your strengths? You know, that's another one that sometimes people just have a hard time articulating on the fly. And that's once again one where you can choose. So, directive questions. These are designed to give the interviewer specific information. What are some of the, what are some examples of directive questions you might be asked?
What do you want to practice?
Okay, what type of medicine do you want to practice? Have you considered specialties? Things like that. Other types of things.
What was your hypothesis on your research?
Okay, yeah. Describe your research. What was your hypothesis? What were your conclusions? Things like that. What else? I put a couple up here. Just why did you choose to apply to our school? What are your weakest characteristics? Those types of things. What are the mistakes sometimes people make on this type of question? You think? Yes.
I think one is that people try and give the answer that they think they're looking for rather than.
Okay, good. That's, something I see a lot during the interview is sometimes we tend to treat interview like it's a quiz. I mean, you guys have been taking tests, for 4 years now, and you're used to there's a right answer, and I have to give the right answer. And so sometimes people are in there doing that, and the way I know that is we'll actually, when you guys come in for a mock interview, we will record that mock interview for you. And you can bring a flash drive, I'll give it to you, you can go over and watch it. But sometimes as soon as I turn that camera off, I see a whole different person. And suddenly I see a personality, and you don't know what it is. It's like you're trying to say that, give me the exact answer I'm wanting, instead of just being yourself. Also, just failing to listen sometimes carefully to what's being asked. And understanding why an interviewer may be asking the type of question that they are asking. And so some of it comes down to preparation. We'll talk about that. The other big category, and this would include ethical questions, is behavior-based questions. Designed to test your skills and or ethics by asking you, how you might handle a situation or respond to a situation or something like that. So give me an example of a behavioral or ethical type question. You remember the one you were asked?
Each of the 3 interviewers asked me one actually, but the
Yeah.
one that I liked was, said if you were to come upon an accident, and in helping people that needed help in that accident, it would later compromise your license, you'd probably have some sort of lawsuit, would you help them?
I saw a similar one in a mini interview where it was, you were like a pizza delivery person, you'd lose your job if you were late, and this person came to you to advise what they should do in a situation. So yeah, I mean, that's tough, isn't it? Any others you can think of that you've heard? Or I mean, there's a whole bunch of them out there, and I actually brought a list that I'll pass around just that has a bunch of behavioral questions and other things. But imagine you're a doctor. That's a common way to start these. And you're in this type of situation. Maybe you're working with a patient who's refusing a treatment that you think is really necessary and it's vital that they receive that treatment. How do you respond to that? So they can be more on the ethical side, they can be more on the behavioral side, which is a little more like this one. What do you think I see, what mistakes do you think people make in responding to this type of question? Yeah.
I'd say being too extreme in their answer, going too far one way or the other, not being balanced and reasonable.
Okay, I think it ties into that a little bit. What I see a lot is people talk about what they would do, but they really don't put a context for why they would do it. Does that make sense? And so sometimes I do, see some kind of extreme things, but what are they really wanting to know? Do they really care? I mean, if it's an ethical, there may be kind of a right or wrong. But a lot of these, there may be multiple ways that you could handle a situation. They're looking at your ability to think and respond effectively. And so it's kind of like an essay question where, I can sometimes get at least partial credit by, giving, what I do know. And so on these types of questions, if your answer, well, in the ethical situation, what would we do in that situation where somebody's there, but you think, that you could, jeopardize yourself legally by helping somebody? What are some of the issues involved in that? And I'm not just targeting you, I'm targeting anybody in the class. What are some of the issues that should be considered? Yes?
The effect it have on your family, your other people that you have lost your job.
Okay. other issues involved with it. Yeah.
You can consider the fact that there are like good Samaritan laws, as long as you practice what you reasonably can do, you are protected.
Okay,
So,
good.
knowing that that's important.
Awesome. Others?
The amount of people you would no longer be able to help if you didn't have a license anymore.
So, anything else? So by articulating, by being knowledgeable about what the laws are, and by articulating, you know, what your considerations would be, then you put your decision or your action in context, and they can understand what rationale would be. And I'll try to demonstrate that too at the end. It's a little bit hard to explain, but just, you know, not just the what, talk about the why. Okay, so before we get into questions, let's just talk about some other aspects of interviews. Common mistakes I see, number one, just lack of preparation on them. We'll talk about how to prepare. The big one, you guys, is speaking in generalities. Why do you want to become a physician? Well, you know, I like to help people. I like science. You know, very general answers like that. Sometimes I'll even get people that will talk about why something's important, but when I want specifics, what type of specifics do you want to include? Yes?
Maybe like for that one question, the process that got you interested. in
Yeah.
medical school.
What got you interested in working with people?
Yeah.
What else? Situations where you've done that and you've enjoyed doing it. You know, I mean, if you have volunteered or something and you really enjoyed a particular volunteer setting or a particular situation you were put in or something like that. You know, another example, what are your 3, you know, strongest characteristics? Usually it's not asked exactly like that. But, you know, I am a hard worker. You know, everybody's going to be saying that. You know, what do you have in your background that demonstrates, you know, that you're able to work hard, that you're able to accomplish many things, that you're able to, you know, succeed even when there's pressure on you, you know, things like that. So, speaking in generalities, seeming stiff or rehearsed, that's what I talked about, where you turn it off and you see the personality come out. What should an interview feel like? Yeah, it should feel like a friendly conversation. Now, you need to be your best professional self, but you need to be yourself in there. And, you know, the more I do these, I'm really starting to come to understand that there's a kind of a couple things that really underlie a good interview. And to me, you have to come across as, number one, somebody that would be successful in their program. You know, I think very much in their mind is, would I want to work with you as a student? And another one is, would I want to have you as my physician? You know, you have to demonstrate that you have the qualities that would make an effective doctor or an effective physician. So a lot of it does come down to interpersonal skills. And then inability to communicate your unique selling points. I used to just, when I was done with these interviews, just turn it off and give a bunch of feedback. I've stopped doing that. I turn it off and I'm going to be asking you questions about your impressions of what we've been on before I give you my feedback. And one question that I like to ask is this. I like to ask, what did you want me to remember about you coming away from this interview? And boy, a lot of students really struggle with that question. Haven't really given a thought to what are my unique selling points? What is it that I would love the opportunity to convey if I have the opportunity? And so know your selling points and think about experiences, aspects of your background that will demonstrate those. This is supposed to be, if you can see it, mistake with the thing of white out covering it up. The reason I put that up there, I want to start by talking about mistakes, but in reality, you know, it's not, a good interview is just not an interview that lacks mistakes. What is a good interview? Impressionable, leaving a positive impression. So what types of things leave a positive impression on a committee? Yes?
I think a big part is how you enter the room and how, like, how you carry yourself when you're coming in to interview with them.
Definitely, your personal presence during the interview is critical. What other things? Yes?
Humility.
Okay, so how you come across it, and it's a delicate balance, isn't it? To tell you the truth, humility, I see people erring as much on the side of being unafraid to talk about, being afraid to talk about themselves and their accomplishments and that, as I do the other side. Occasionally I get people that just, they come across as a little arrogant or that. But understand, there's kind of a balance there, and that comes with practice. But for some people, it's just, understand, you are there to talk about why you think, you would make an effective student in their program and an effective doctor. And there's nothing wrong with doing that. You talk in an interview in a little different way than you would to a friend. You don't go up to a friend and say, well, I think this is one of my strengths, and I think this is why that strength is important. Your friend would probably not stick around with you much. But in a medical school interview, that is appropriate. But definitely personal qualities like that are things that they're looking for. What are some of the qualities they would maybe be looking for in a physician? Yeah.
Someone that can get along and interact with people really well.
So somebody that can build relationships effectively, somebody that communicates clearly and effectively. Good. Yes?
I think someone that can be straightforward,
Okay.
even if they're swimming upstream, so to speak, something that they know is not exactly what they want to hear.
Yes, somebody that's honest, somebody that is genuine, somebody that recognizes their own strengths and weaknesses and is working on those things. Somebody that has clear goals and aspirations and knows where they're going in the program. Yeah.
Someone who can take mistakes and critiques and stride and apply it for their circumstances.
Yeah. Well, we'll talk about the weaknesses question. Well, let me just talk about it now. On the weaknesses question, that's one that I told you, if you haven't prepared for it and thought about it, it can be really, really tough to answer that in the spur of the moment. So how do you handle, if you're asked about your weaknesses, how do you handle it? Yes?
I think it's important to be honest. I think people, I know from like a business setting and like interviewing people for business interviews, I think this is a concept that can apply for med school interviews. People ask, what's your weaknesses? And they'll try and take that and flip it around and say things that really aren't weaknesses. Like, oh, well, my weakness is I just work too hard, or I'm, too thorough. That's not a weakness. You're just flipping a positive. But I think you need to be honest with what your weaknesses are.
Yeah, there's a lot of books out there on interviewing, and some of them actually give that advice, that you take a weakness that can also be a strength. But it's very tricky to do without it sounding kind of cliche and trite. And I agree with you. I think you need to be genuine, and be able to share things about yourself and not have to, do it to that point that, yeah, sometimes, and I hear that a lot, sometimes I just work too hard, and it just, comes across as trite. Yes?
I think it's also a good thing to show them, like, to express your weakness, but then show how you're working on it.
Good.
So don't just show, like, this is my weakness, I stink at this. But
Yeah.
show, yeah, I'm working on this.
I agree completely, and that's one of the big things I work on with students. So number one, understand that you only have a minute or two to talk about a weakness with somebody. And I tell students, I would never plant a seed that the person, the interviewer, could grow that seed into something in their head you wouldn't want them to grow it into. And so pick things that, I would pick things that aren't going to call into question in any way your ability to be successful in a medical school program, or your ability to be successful, working as a physician afterward. And so, pick things, you get to choose kind of what you bring up, and I wouldn't bring up something like that. But at the same time, even if you accidentally said, I have a hard time getting out of bed in the morning and I'm usually late, you could almost salvage it by doing exactly what you're saying. I would never say that, but, and so I have had to learn, knowing that I'm going to be a physician, that punctuality is something I have to work on. And these are specific steps I've taken in my life to improve my punctuality. And it's still not where I want it to be, but it's gotten a lot better. Does that make sense? And once again, I wouldn't choose that one to start with. But by talking about what you do with the weakness, that can be a real help. Other things for weaknesses. Okay, let's talk about two words that I think will really help you. To me, successful interviewing comes down to just two things: preparation and practice. So you guys know you have an interview coming up at some point, how can you start preparing for an interview? First of all, when do you start preparing? It's never too early to start preparing. Realize you guys are building the background that there's going to be the toolkit that you're going to use during the interview right now. A great interview begins by having great experiences. And, you know, people that have volunteered, I mean, I know you guys have to do volunteer work and have to do some of those types of things, but people that have become invested in those types of experiences and have gone above and beyond, that can be wonderful as far as giving you material to talk about during your interview. Other things? Yeah.
I think do a little bit of research and get familiar with the school and what they're mostly associated with.
Definitely researching the school. Let me just go through kind of a list here because we're going kind of down in order. Well, you know what? Let me use this example. Tiger Woods. When I was here, I took a golf class here at the university. I wanted to learn how to golf better because I sometimes go out with like employers and that. And I'm like, oh my gosh. So I took this golf class. And my wife gave me this book. This was before Tiger Woods was kind of, you know, disgraced and all that. But Tiger Woods, How I Play Golf. So I took that book, and being a good student, I read it. And I actually had to take the class pass-fail, or credit, no credit, because I was failing the class at midterm. I could not two-putt the green for the life of me. And I thought about it after, and what I realized was I was used to doing things where I could study and spit it back. But you don't learn something like golf by reading about it and then going out and doing. You have to practice, practice, practice. And it takes doing it, you know, poorly, figuring out how you can do better, redoing it, figuring out how you can do better, redoing it, and it takes practice to be able to improve. Does that make sense? And interviewing is the same thing. I mean, you can read all about interviewing, but the only way to really get better in interviewing is to practice it and to make some mistakes and to do better and better over time. And so with the practice, let me talk a little bit about mock interview with you. I would much rather you get the mistakes, some of them worked out with me, than in that medical school setting in front of somebody you've always, you know, been looking forward to talking to get into their program. Does that make sense? So as far as preparation, then we'll go a little more into the practice. Let me tell you about kind of my interviewing story. I have a master's in educational psychology. I went out to apply for a job in it, and this was actually a behavioral health type job. And I went to this place and I thought interviewing, you know, it can't be that bad. They're just going to ask me about myself and, you know, I'll tell them a little bit about who I am and show them I'm enthusiastic about this and it'll go fine. I got in there and they started asking a bunch of these behavioral questions we've talked about. And boy, I started to just get flustered and it just got worse and worse. I completely bombed the interview. I decided after that, well, maybe there's something to this that I need to know. And so I decided I'm going to spend some time practicing. And I spent the next few weeks really practicing a lot on interviewing. My next interview, I went in there and it went really, really well. Same type of interview, but I did much better on it. And that happened to be at a university, and that kind of started my career in the university. What's the moral of that? That you can use your first interview as to get the bugs out? That might be the one you really want to do well in. The moral of the story is come see me and practice, because you guys have been putting a lot of work into making yourselves an attractive medical student, haven't you? I mean, if you think of all the hours you're spending in class, keeping your grades up, all of the extracurricular things you guys do, a lot of time and energy. You don't want to spend all that time and energy and then only spend, you know, 2 days before the interview thinking about the interview process itself. Because if you're unable to sell and present, you know, your background, then that can negate a really good background. Yeah?
How many times would you recommend a student preparing to apply to medical school to come in and practice with you before they do that?
Unfortunately for me, I can only do one practice interview just because I do so many of them. Mm-hmm. But they don't have to be with me. Only Dr. Fritzler usually sits down and kind of practices some. But you can do them with friends, spouses, whoever. It's not so critical, even the advice that you're receiving, it's just that you're practicing doing it. I've worked with students that have also just videotaped themselves, or even sometimes just done it in front of the mirror. It's just practicing enough so that you start to get comfortable with it. Does that make sense? So yeah, I wish I had time, I do the pre-med, I do all of the pre-professional ones, plus all of the ones for the College of Science, and there are just so many. Occasionally, I will bring somebody back just to work on a specific aspect or something, but just to be fair to everybody, that's, you know, unfortunately, one shot. So when do you want to come do the interview with me?
ASAP.
I would do it within a couple weeks of your real interview. I would prepare like my interview is going to be your real one, because I can be most helpful to you if you're well prepared, and I can give very specific advice. If it's just, this is kind of the first shot, I'm happy to help you in that way, but you're just kind of, in my mind, wasting the opportunity. Does that make sense? So, all right. So, preparing. There's my number if you want to write it down. That's my office, 801-626-6393. My name is Greg Nielsen. Just tell them you want to schedule a mock interview with Greg. And once again, best to do within a few weeks before your interview. So as soon as you hear back from the school, call and get it scheduled. Sometimes it does take a little bit of time to get in with me. So please don't call 2 days before your interview and expect that I'm going to be able to take you. You know, I mean, I'll try to accommodate if I can, but it's hard for me on some times of the year. I just get booked back-to-back appointments every day. And so, dress appropriately for it. Please dress and act like this is the real thing. Yeah?
Are you available year-round?
I am available year-round. During the breaks, I do take time off in that, but I'm a 12-month employee, which doesn't help too much because I don't get a lot to come in during the summer anyway, but if you do run that situation, so. And two things I want you to bring to it. They'll tell you this when you call the schedule, but I'd like you to bring a flash drive. And the flash drive is to copy the video on. I used to try to email, but it's just a real pain. Video files are pretty big, and to upload it and download is a pain. So it's easier if you have a flash drive, they can just stick it on for you. And then if you want to bring a copy of your application materials, a resume, anything like that, I'll glance through your materials just to get an idea of who you are before. Now, are the schools going to have your materials when you go into interview? Some will, some won't. There's blind interviews and there's materials where they have them. A blind interview, the interviewers will really know nothing about you before you walk in there. And some schools like to do it that way just to get kind of a fresh take on an individual. But assume that, you know, they might have those things. But for me, sometimes I will target things that talk to you about in there because a lot of schools do what you were saying as far as picking aspects of your background and asking about them. And then once again, prepare ahead, treat it like the real thing. Okay, how to prepare. Number one, know yourself. And by the way, let me pass around this list of questions. The purple and white are the same thing. It's just somebody, I guess, didn't take the purple out of the machine. But what are your strengths? Know your weaknesses. Know your goals. Know your motivations for going into medicine, why you chose that as a career field. What else might you want to know? Your plans. Think about, you know, if you consider specialties. Definitely think about your motivations for applying to the people or to the school that you're sitting in interviewing at. And why you selected them. So know yourself. Research the institutions where you will interview. What might you want to know about the institution?
What specialties do they have there? What kind of area are they in?
Yeah, what's their focus? What do they do well? What do they excel at? You know, every institution has certain things that they really focus on and they're proud of. You know, I wouldn't just cite statistics, you know, I get that sometimes, whereas where you're, you know, number 8 on this, you know, it's all right to know a couple things like that, but know it in more detail. What else might you want to know about them? What type of opportunities they provide within your training, what types of educational structure they have, you know, how their schools vary quite a bit on the way they educate students. So those types of things are good to know. Know your profession. It's very common in these interviews, both MMIs and regular interviews, to have situations where you're asked about current events, and especially current events within the medical field. And to tell you the truth, that's a common weakness of students. I mean, and I understand it completely. As a student, you are so focused on you know, what you need to get done today and this test that's coming up the next day and I've got to go work here, that it's sometimes we lose track of the bigger picture and it's easy to kind of lose track of current events and that. So be familiar. It's, you guys, Affordable, you know, Care Act, it's not enough to know that there is an Affordable Care Act. That's not going to set you apart from other students. It's not enough to know basically what the Affordable Care Act does. You know a little bit about some of the details of it and how those are impacting the profession. Where might you go to find that information? I mean, internet's a good start for a lot of things, but where else?
Doctors.
Yeah, doctors, you know, you guys are out there shadowing and doing these things. Ask about people's experiences with it. You know, if you're working in the setting.
A lot of times when I talk to doctors about the Affordable Care Act, they're always super negative about it.
Yeah.
And so, I mean, I don't think going into an interview with that kind of bias would be ideal, but that's why I would go to the internet to get more than just a doctor.
I agree with you completely. And I'm not saying that you take on somebody's opinion, but I think it's important for you to understand how it is impacting different settings. Because, you know, sometimes, to me, a really great answer is I've occasionally had students who have been in the medical setting working, and they're asked about something like that, and they're able to share, this is an experience we had. You know, and this is how it's impacting our office, and some of the concerns we have, some of the things that are working really well for our office. Also, during these types of things, I mean, you're right. You want to come across as somebody that's knowledgeable about it. Sometimes I get people that are so far to one side, they just seem like they're very narrowly focused and closed-minded on the issue. I think that can hurt you as well. So I tell students I would talk about an issue as if the person in front of me possibly has the opposite view. And you know, you can express an opinion, have asked for an opinion, but it should be an informed opinion, not a, you know, simplistic opinion. But knowing issues, I would make a list of all of the issues you can think of that are impacting medicine right now and just become familiar with kind of what's going on with them. Sometimes I've asked a student a question, do you know any, you know, do you know any lawmakers that are involved with that issue right now? And shuts people down real quick. You know, because sometimes we've read a little bit, but we really don't understand what's happening right now with some of these things. And so, oops, don't know why that misnumbered, but know what to expect during the interview. We're going to talk about that in a minute. Prepare questions to ask the interviewer. What are some of the things you can ask an interviewer? Number one, just expect that you'll probably be asked at some point, you know, if you have any questions or things you'd like to talk to us about. My advice here on this, I would not try to sound impressive or, once again, that just comes across kind of insincere. While you're researching, write down good questions you have. You know, they shouldn't be things you could just go on their website and easily read about. But, you know, things like, I was reading that here's one. You know, I'm very interested in having this type of experience. When do you begin getting your students involved with this? Or I noticed that when your teaching has this structure, you know, can you tell me a little bit more about how this aspect of that works? Those are good questions. And they should come from you, and they should be helping you in making the decision that you have to make. Practice common interview questions. And so I passed around that list. Once again, practice, practice, practice before you go in. And the reason for that, you're going to find that you're not going to know exactly what they're going to ask you, but interview questions tend to follow major themes. Most interviews, you will be asked about your motivation. Most interviews, in one way or the other, you're going to be asked about your strengths and likely weaknesses. Most interviews have some component that deals with current events or stuff like that. Most interviews will be interested in why our program. And there's lots of different ways to ask that, and that's what I try to do is categorize some common questions on there, but, you know, be prepared. You guys are familiar with like student.net and some of the forums out there, aren't you? You know, look up your school. I mean, it's not a guarantee that you're going to get something, but just by reading through those, you can get a flavor for the different types of things students experience during these interviews. All right, let's talk about grooming briefly. I'm not going to take the time to tell you to use deodorant and all that, but, you know, be well groomed, good breath, obviously. Facial hair. it needs to be neat, professional looking, or it shouldn't be there, is kind of the gist of it. Now, if you do choose to wear it, to tell you the truth, if you want to come in with it and ask me, it's something that some people look good in it and some don't, and part of it's just the way you wear it. But let me tell you my experience. I came here to interview. I had a beard and mustache, but I had a mustache at the time, and it was very neat and it looked fine. But I thought, well, you know, I don't know what to do on this. I'm just going to shave it. What the heck? And I shaved it, and I went in, and I've always been glad I did because my first boss here, I think it would have actually hurt me. He was very conservative. And so if in doubt, err on the conservative side. You know, it's not going to hurt you to be too conservative. It may hurt you if you diverge too much the other way. But facial hair more and more can work. It just, you have to be very careful with it. Manners, obviously be courteous to everyone you meet, you know, and that can include support staff and people there, and realize you're being evaluated the entire experience, not just during the interview itself. So, look your best. I'm going to put up attire here. What about attire?
Needs to be clean.
Needs to be clean. By the way, we're going for an hour, right? Was that correct?
Yeah.
Or you go 50 minutes? Okay, because I was told an hour, but I get so used to my classes going 50 minutes. Needs to be clean. Men, I put it up there, but without looking. Before I get it, jeez. Men, what are you gonna wear?
Suit.
Khakis and a golf shirt. Suit and tie, isn't that old-fashioned?
Professional.
It's business professional. That's the standard, is business professional. So usually that involves a traditional suit, typically a dark colored suit. You just don't want to stray too far from, you know, think of what would you see the president in and what would you not see the president in, you know, type of thing. Shirt should be light colored. You can sometimes get away with, you know, somewhat of a pattern as long as it's, you know, subtle and it's not distracting and it matches. Tie should be compatible with what you're wearing. It should be updated. You should have a leather belt. You should have dress shoes that are polished. I think most males tend to understand business, professional, what the standard is. But if you don't have one, borrow one or go get one. And, you know, don't sell yourself short by the way you're dressed, because you're going to walk in and other people are going to be dressed that way, and if you're not, you're going to feel that you stand out. You can always take a coat off. You know, if you go to an interview setting and you're feeling your guilty pleasure, you can't put it on. You get there and you don't have one. Everybody else does. Women's a little tougher though. So for females, let me put up the men one, see whether yeah, that was pretty well, good summary. Make sure your socks match, no white socks. What do you think for females?
Nice, either slacks or skirt.
So do we wear skirt or slacks?
It depends.
Either. Either, as long as they are a professional suit type thing, are appropriate. And so, I'll just put it up here. But, you know, really, the standard is not that different. Appropriate length, you know, to me, appropriate length means, you know, a business type thing is not down to here typically. But also, you know, you don't want to be one of these that you're sitting there trying to finagle the whole time to cover yourself up because your skirt's too short. That's not professional either. So it should be appropriately length. You should have a blouse that's lighter colored than the suit, long sleeve, collar, or, I mean, it has both the collar and conservative neckline, you know what I'm talking about there. You know, just be professional. This should be the same standard. Yeah?
So for women, what is your take on whether or not they wear a suit jacket or if they just blouse and skirt?
I think either can work, but typically, I tend to err towards a suit. I tend to err towards kind of the same standard. You know, for men, I just think that it looks more professional, but I do see both, and I've seen people that are okay, you know, they've written on it, that are okay with both, so. But anyway, I don't even know what medium heel leather pumps exactly means, but you guys know. Accessories, you know, minimize both for males and females, especially, you know, females, you're all right with an ear piercing or something like that, you know, an earring if it's small. But it should be fairly subtle. If you have multiple, take them out. If you're males, I would probably just take them out. The idea is, once again, err on the conservative side. You know, this isn't a judgment about, you know, dress and what's wrong, what's right. It's a judgment about how sometimes people perceive, and what people perceive as professional looking and not professional looking. And so I put tattoos and stuff. I mean, that's mostly not for you guys, but for a typical job interview, that is something to think about. If you do have body art, it's usually that's okay. So, posture. Stand up straight, you know, display proper posture, place your hands on your lap. You know, just avoid extremes on it. If I'm sitting here interviewing with you, and I'm like this, talking about myself, and I can't cross my legs, I'm not flexible enough where I do that, but when we cross our legs, we tend to kind of lean back and that. I mean, what's the impression it's giving you? I'm relaxed, a little casual though, you know, that I'm not understanding the seriousness of, you know, what I'm doing. And so, what if I am like this? How's that feel? Little odd, doesn't it? Little aggressive. So, you know, sit up straight, feet flat on the floor, put your hands on, kind of hard, this chair's so comfortable. But, you know, and I like to put my hands on the lap for this reason. Some of you guys are going to have the tendency to go like this with your hands and to express in that. That's why I like to put them down and not, if I get them together, they tend to pop up. Okay. Let's talk about, in the time we have left, once again, if you're in doubt, err on the conservative side. If you want to bring what you're planning on wearing, I'm happy to give you an opinion when you come in. Allow extra time. Maintain good eye contact during the interview. That's another big one that I have to work with some people. Get used to it. 99% of people have the tendency when they talk, or when they think, I'm sorry, to look away. So I'll ask a question, and while they're thinking about it, they're looking away. Now, I don't mean you can't ever look away, but you need to, for the most of the interview, be looking at the person you're talking to. You know, so you can look away for a second, but it needs to come back instead of, you know, every time you do that. That's very common. So practice eye contact. Once again, mirrors, cameras, things like that can be very helpful that way. Keep your answers concise and relevant. Some people have a tendency to ramble. How long should an answer be?
Depends on the question.
Depends on the question. Maybe a couple minutes, minute and a half, 2 minutes. So I would, you know, what people will find though is when you're in an interview, you kind of lose track of time. It's easy to do. So when you're practicing, you might take a timer set for 2 minutes and just get kind of a feel for where that's at. It doesn't mean that every answer has to be that long. Some might be yes or no. Sometimes it might be appropriate to go a little longer, but on average, you don't want to be going much longer than that. Be positive and enthusiastic. Never say anything negative about about a past experience, a past associate. If you're looking at a DO program, don't say negative things about MDs. I mean, I hear that sometimes where, you know, I want to be a DO because EMDs don't, you know, look holistically enough at a patient or something like that. And then relax and be yourself. Now, really quick, multiple minis. Well, for fear, I put that down. If you're nervous, come talk to me about it. I can talk to you a little bit about that. But multiple mini interviews. I usually like to ask you what they are, but let me just go through it real quick. What they are, these are getting more and more common. Every year we have more students that are expected to do this. And they are a structured interview, and it's focused a little more on personal characteristics than just content. I mean, it involves content, but what they are is they are a time circuit where basically you're going to different stations. And if you have anything to correct me on, but you're going to these different stations, and at each station you have time to prepare to perform a task. And there's an interview in there, or an interviewer in there. You may also have an actor, something like that. Before you go in, you're given a sheet that describes what you're going to be doing, and you usually have a couple minutes or so to prepare. Did you have preparation time for it? And then you walk in and you do it. And so, you know, usually 8 minutes or less. Some of the things they look at: communication skills, compassion, teamwork, cultural sensitivity, ethical decision making, critical thinking, awareness of healthcare issues, whatever. So you've done it. What makes the multiple mini interview different than a standard interview?
you have less time, so you have to be even more concise and relevant in your answers.
Good.
It's also very, like you said, some of the stations have an actor, so you actually have to interact with the person as if you actually were the physician
Yeah.
instead of hypothetically thinking.
Role-playing
Role playing.
is something that if you haven't done it, once again, just expect it and maybe practice role-playing, because role-playing can be really intimidating if you're not used to doing it. I hate role-playing, and I did a lot of it in my training, so. So you're given the questions, you go in, and then basically, once they're done, they evaluate you while basically the next candidate's preparing coming in. So the person there will give the evaluation of how you did there. And so you're being evaluated independently at each station. So it's just some things to do. I mean, it can be a long process. How long did you do it for?
It has 8 stations.
8 stations, how long each?
About 7 minutes each.
Okay, so yours was closer to the hour. I've heard some go up to a couple hours. Not common, but it does happen. So anyway, some recommendations. Number one, if you know you're doing this type of thing beforehand, that can be really helpful. And a lot of schools will let you know that it is going to be an MMI. If you are doing an MMI, when you come for the mock interview, let me know beforehand. I can't obviously simulate an MMI, you know, in my half hour I have with you for a mock interview, but I can at least do one question that way where we time it. And we try to do that where I give it to you, you have a couple minutes prepared, you come in, you have to do it with me. And so I've done that with some students before. Practiced responding to those types of questions. I have some of them, I should have just brought a list, but you can go online and there's tons of sample sheets out there now for MMI questions. Just in the last couple of years, those have really multiplied. So get familiar with the types of things that are asked and just practice doing them. You're probably not ever going to be able to anticipate the type of thing you're going to get, but you can, what did I do that for? Okay, do it. I would, like I said, practice role-playing until you become more comfortable doing it. And then talk to other people that have done MMIs. Part of it's just, it's so different than other things you've experienced. You know, you just getting familiar with what might happen will help you set at ease. But the idea is time, because you're right, 8 minutes sounds like a long time. It can be both. Sometimes it can be, you feel like you're trying to struggle to fill it. Other times it goes very fast and you think you're going to have all this time and you don't. And so you need to just practice till you get a sense for what 8 minutes feels like, and then you can adjust when you're in there. Would you agree? For how you're going to do that. So anyway, you guys, that's what I brought. I was going to do a little bit of practicing, but I want to make sure I got the material first. So come see me for the interview. If you do have questions beforehand in that, come see me. I share an office with Susan. I'm there Tuesday and Thursday mornings for an hour or so, but when I'm not there, I'm always down at Career Services. And that's my main office. And I'm happy if you just drop by to answer questions, as long as I'm available, but I do get really busy sometimes. And so if you're really wanting to meet with me, call and they have my schedule, they can tell you when I'm available. So, thanks you guys.